Next presenter is Gus Meerhoff. You all know Gus as the host of this conference, and Gus works at the Royal Dutch Association for Physical Therapy. He looks there and works there at the development and implementation of guidelines, and also the clinical registry that KNGF is running to get data from practice into policy making. And while the mic is being set, wrong way. Okay, Gus, the floor is yours.
Here's the pointer. Well, thank you, everyone. The challenge for me is that my speed dating is not 15 minutes, but 10 minutes. And I have to explain all about our guidelines about over the last 20 years. That's the challenge for now, which I will never be able to achieve. But the luck I have is that in the afternoon, there are two speakers who will elaborate a little bit further about a specific guideline we have developed and specific implementation tools we have made. So if we are lucky, we make it in 10 minutes. It's about clinical practice guidelines, and what are my key topics, my key messages, is first a short summary of the history of KNGF's developmental activities over the years. Then I only can give a brief explanation on the developmental process, but I can refer you to some documents which we have made within the ERWCPT, which are translated and describe it in English in full length. Then I'll say something short about the implementation initiatives. It's only short, and in the afternoon there will be a longer presentation about it, so much information about it is to follow. And I still have a bullet about the current changes, but I don't know if I have the slide in it, but I can explain a little bit about it. Well, a long story short, we are developing guidelines for about 25 years now. It started back in 1994, where we didn't really have a formal methodology, but we first tried to develop three guidelines, a certain number of guidelines, and after that worked out successfully. In the period between 1998 and 2007, we got what we believe we got to be very productive, and we have developed 16 guidelines in total, based on a formal methodology. And this methodology has been revised two times after. For the first time, it was in 2007. And the main reason is international developments. The GIN Guideline International Network was originated in 2001, and it helped the profession of guideline development to develop on its own. So there were new tools which needed to be implemented in our methodology as well. And the second more important thing, which has been said before as well, once you have developed guidelines, you need to update them. And we didn't have a formal strategy on how to do that. So the new thing in the 2007 methodology was a strategy for updating the existing guidelines. Well, from 2015 and further, we now still use this methodology. We decided that we needed to try to make the guidelines not as lengthy as they were, the 200 pages. No, we needed to bring them back to an 8, 10, 15-page document, which can be used in clinical practice more easy. But on the other hand, we still needed to let all the readers, give them the possibility to read the full-length document. So in the 2015 methodology, we focus on applicability and on a user-friendly format of presentation, which is a new website we have in which we try to bring the recommendations short and applicable to the clinical practitioners. And it's brought into layers. So the first layer is just the recommendation, which is short and easy to use for a clinical practitioner. But there are layers behind it which give the full-length information for students, researchers, or just a clinical practitioner who wants to read more about the recommendation. And last but not least, we put a focus on our implementation. But as you heard Emily speaking about, how is the implementation? Well, in the Netherlands, I think we tried to implement the guidelines as good as possible, but I think we can do a little bit better. And nowadays, with the technological developments, we hope that bringing e-learnings and so the digital formats of presenting a guideline will help us in stimulating clinical practitioners to read about the guideline. Then the developmental phase explained. will explain the 5 main steps, and I will immediately tell you that you can, because this presentation will be sent to all of you, and you can use the 2 links below to, they will guide you to English documents about an infographic about our guideline developmental process and the methodology, which is explained in English. So then if you want to read further information, you can use that document, and I'm now doing it only in a short way. First, obviously, a preparation phase. In the Netherlands, we have 3 teams, an author team, a working group, and a review group. And these teams make the guideline over a period of approximately 2 years. Within these groups, within the working group and the review group, not only physical therapists are represented, but also general practitioners, medical specialists, patient representatives, of course, and insurance companies, because we are obliged by the government to include all these parties, and all these parties have to agree with our guideline before our government will give their approval to our guideline, which helps us in the reimbursement questionnaires. And we start with the barrier analysis. What are the clinical questions, the key problems physiotherapists and patients have in the field? So these barriers are asked to physios and patients, and this is done in focus group meetings. After we have formulated the barriers, we can use these barriers to formulate the clinical question. So what is the question we need to answer to resolve the barrier which is present in the clinics? And we do this in 3 steps. First, we do a systematic literature review. So this is, if we look back at the presentation of Philip, the scientific circle. And then we include the patient preferences and the clinical values in the discussion with the working group and the review group. So there you see the 2 other circles which Philip mentioned about the patients and about the clinical values. Again, these are not only the clinical values from us as PTs, but also from the general practitioners or orthopedic surgeons or whatever health professional which is involved. Also from the insurance companies, which make the discussion difficult, I can assure you. Using these 3 circles, science, patients, and clinical values, we formulate a recommendation, and this recommendation is an answer on the clinical question, which is being formulated based on the barriers in the preparation phase. And afterwards, because we try to make our guidelines as practical applicable as possible, we do a field test, and we ask our members, KNGF members, which you've met this morning in the plenary opening, to review our guideline and give their feedback on readability, applicability, and spelling, etc. So we try to engage as much as PTs from the field as possible. Afterwards, there's a formal procedure to get authorization from the participating parties, since we need this authorization to get the status of our guideline, which is one of the big challenges, I can assure you. And then the implementation, well, later on this afternoon, we will tell you more about the implementation, but one thing we do is publication on our website. We develop an e-learning. We write articles in our own magazine of our association, but we also work on peer-reviewed publications in the APJ magazine, and we give different lectures over the country, within the country, and Wilfred will give one of his lectures this afternoon. Then the implementation, I see I only have 1 minute left in the back of the room, so again, this is the online publication, and I was planning to maybe click on the different buttons, but there's no time for that. But the good thing is, if you have this presentation at home, you can use the deep links to find the web pages where it is on. The e-learning will be presented this afternoon as well, and I have said the other things on the former slide. So this is the focus we have on implementation nowadays, and the new thing is the online publication, the way we publish it online in our e-learning. Then last but not least, the current challenges. As I said, we need a tripartite approval of the guideline. Well, and it's not the difficulty to get an approval of the patients. It's not the difficulty to get the approval of the physiotherapists. And also with our colleagues, the general practitioners and orthopedic surgeons and other medical specialists, they approve our guideline relatively easily because they are involved in the whole developing process. But the difficult discussion we have is with the insurance companies, because they understand what is written from a content perspective, so they agree that they agree on the content, but the difficulty is that they have to pay it. And there, the difficult discussion starts, and this morning it said as well, it becomes more the combination of science and politics. And, well, I can only say we haven't really figured it out yet, but the good thing is that they see, because they are involved in the working group, they see the work we do, and they appreciate us for it, but we're not there yet to approve the latest 2 guidelines which we have developed, so that's still a struggle and a challenge we have. And the last one is external guidelines, and this will be presented this afternoon as well, because the aim is that the guideline we develop will not only be seen by PTs, but we aim for the fact that other professionals get to know our guideline as well. And we have a very nice example which will be presented this afternoon of our osteoarthritis guideline, which is on physiotherapy, of course. But the recommendations on physiotherapy with osteoarthritis patients are being taken over by the orthopedic surgeons one-on-one, because they were involved in the process and they believe that it are good recommendations. So there you see that the guideline of KNGF not only stays our guideline, but we try to bring our knowledge within the guidelines of other professionals. Thank you.
Thank you, Gus, for presenting 25 years of guidelines in the Netherlands. It's actually a bit of a going back into my own history in my professional development, because that 1994 guideline was my first project at KNGF. And it's good to see that things have changed in 25 years and how it has changed guideline methodology and the way to deal with the complexity in healthcare. And not everything is solved, but at least it's good to have to see that you've got a good grip on what's going on and how to make sure that physical therapy is being represented as good as possible in those developments. So I think that's a nice example. We have time for 1 or 2 questions. Yep, there you go.
Thank you, Gus. Very interesting presentation. We are, of course, amazed, those who are not working with the guidelines directly, amazed by the extent of work you have done over the years. So my question is, how many people is fully professionally working on guidelines in your association? So full time.
I have the microphone watched on. Yes, I was waiting to get the microphone back, but no, I can speak. Well, that was my first slide, and since I had not much time, I wasn't able to introduce them properly. But we work with the 5 of us on the department, on the quality department on guidelines, and it's not 5 full-time equivalent personnel, but it's approximately 2.3 full-time equivalent who work on the guidelines. And these are only the persons who work at KNGF, because Wilfred is going to have a presentation this afternoon. He's from the Leiden University Medical Center. He is one of the authors. So in the author group, there are 3 authors. One of my colleagues is an author, and 2 external professors or senior researchers are authors. And then again, we have a working group which consists of approximately 12 persons, and a review group which consists of 12 persons. So in total, there's like, with the field test, it's, I would say, 35 people who are involved in the developmental process. Not full-time, of course, but it's a thing we do together with lots of other people.
Are all these experts getting reimbursement for working on the guidelines?
No, well, they get a very small reimbursement, like travel expenses, and they get a small reimbursement for the 5 meetings they have. So yes, they get a small reimbursement. Yeah.
Thank you. Thank you, Gus, for your presentation. Applause.